tell so much from a person just by going here. So now just by going underneath here, it's actually a little difficult for me to slide my fingers underneath this area of the hand. And again, I'm just making a thing. So I'll quickly just go underneath the wrist where I have the difference of the phone. But the reason it's difficult is because in this position, I cannot get her wrist to rotate. See, and I'm actually going to force it. So see, the wrist right in this position doesn't want to rotate. So what it was doing, this is, by the way, is this very similar phenomenon that kids have their hips pinned. That pin, what it does is the pin comes out over the trochanter. It truly affects a rotation, and you really have to keep this in mind with the movement of the back and the movement of the hip flexors and all of that consideration, because what it does is the pins are out here. Sorry that I'm going off the subject, but it's just I have a couple of kids going on with that. But it throws the weight off like this. So basically I should take a leg or whatever. There's an acceleration. I should be able to go boop, 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 boop.
Now what does that mean, pinned?
They've redone the hips so to
because my hip is messed up right now, and that totally makes sense what you just said.
Well, yeah, when you throw off the acceleration, we should have an acceleration through our whole bodies. But obviously, but you'll be surprised how much your hip will change, just like Will's did, just based off the hand. But so when you go like this, just the weight of the pins, and I'm sorry, people say, but it's only a couple of ounces. I don't care. The brain wasn't there before them, and it just throws. But you're going to affect the acceleration and the rotation, just like I'm trying to do here. In your case, it's also the elbow, but I'm just talking about the mechanics of when they redo hips and stuff, especially in the munchkins. It affects the total roll and the acceleration and all of that of the body, and you really have to work with it. It's not about strengthening the leg again. You have to deal with the internal acceleration with the system and letting the system, in a sense, override those pins, which can be difficult to do when a child is cognitively impaired. In other words, if they're not they're still nonverbal, you can't talk them through it. Really. Hi, I'm Michelle from Movement Lesson, and if you'd like to see more of this video, I now have a new site for that's subscription based for my longer videos or my instructional videos. So if you're interested in seeing the complete set of this lesson, to sign up, it's $5 a month or $50 a year, and that helps pay for lessons for other children. So thanks.